Now we are going to see drugs which are used in gout management and hyperuricemia. Gout is nothing but it is a purine metabolic disorder. Purine metabolic disorder in the sense increased levels of uric acid in the plasma, which is caused due to the increased production of uric acid, or it have some problem to excrete from the body. So excretion is not there and increased production may cause the increased levels of the uric acid in plasma. This leads to gout. So what happens? Manifestation of the disease means it causes intermittent attack of acute arthritis. So that is deposition of urate crystals in the joints. Coming to the uricemia, hyperuricemia. What is hyperuricemia? It is of two types. One is primary and one is secondary. Coming to the primary, it is idiopathic. That means no known cause. There will be no any cause is not known here. It may cause due to the genetic enzyme defects. Second one is the secondary hyperuricemia. It is associated with the cancer therapy, means we are taking some drugs that may leads to hyperuricemia. Okay, deposition of uric acid in the plasma. Okay, so coming to the second one, it is a secondary one. It is associated with the cancer therapy, which is a cytotoxic, leads to increased uric acids due to cell degradation and DNA degeneration. So by using cancer drugs, it is cytotoxic, which leads to increased uric acid due to cell degradation and DNA degradation occurs. And also drug therapies like thiazide diuretics, loop diuretics, and pyrazimides, levodopa, etc. These are the weak acids. These leads to uric acid levels increase in the blood. It competes with urate secretion on the secretion pumps in the kidney, mostly in proximal convoluted tubules. That means it is not excreted from the urine and it is deposited in the blood. So drug therapy leads to increase in the uric acid deposition in uric acid levels, increase in the uric acid levels in the plasma. This is the secondary type of hyperuricemia. Primary is idiopathic. It may cause due to the genetic enzyme defects. Now see the classification. Drugs used in gout management. Drugs used in gout management is that there are two types. One is acute, one is chronic. Acute management is caused by different drugs and chronic hyperuricemia is caused by different drugs. Acute, we are also calling it as acute arthritis. Chronic hyperuricemia also called as prophylaxis. Here in the acute, we are going to use NSAIDs, colchicine and glucocorticoids. See three types. NSAIDs, colchicine and glucocorticoids. Coming to the NSAIDs, indomethacin, naproxen, diclofenac, these drugs are used. So it may leads to increased concentration of synovial fluids. It is better tolerated drug than colchicine. These NSAID drugs are better tolerated when compared with colchicine. So NSAID drugs are indomethacin, naproxen, diclofenac. Okay. Coming to the colchicine, coming to the mechanism of action, it binds to the tubulin in the microtubules. It binds to the tubulin in microtubules. That leads to decreased microtubular polymerization, which leads to decreased leukocytes and leukocyte migration. Decreased leukocyte migration. This leads to decreased phagocytosis. It leads to decreased inflammation. Okay, it is anti-mitotic also. It can be used as anti-cancer drug also. It is having side effects. Okay, so the side effects are also two types, acute and chronic. Coming to the acute, it causes severe gastrointestinal disturbances and abdominal pain and diarrhea. Coming to the chronic, it leads to hematuria, agranulocytosis, alopecia, myopathy and neuropathies. These are the side effects caused by the colchicine. Actually, what is the main mechanism? It is going to bind with the tubulin in microtubules. This leads to decreased microtubule polymerization. This leads to decreased leukocyte migration, leads to decreased phagocytosis, decreased inflammation formation. Okay, it is also used as anti-cancer drug. Coming to the next class, NSAIDs we have seen, colchicine we have seen, and one more is glucocorticoids. These are the drugs which are going to show rapid action. Okay, if if other drugs are not responded in that particular patients, if NSAIDs or colchicine is not responded, at that time these glucocorticoids are given to that patient. Okay, some of the examples for this glucocorticoids are prednisolone and methylprednisolone. So it is given systemically, and when a particular joint is affected, it is given intra-articular injection to avoid the side effects. Okay, and coming to the chronic hyperuricemia or prophylaxis, it is uricosuric agents and uric acid synthesis inhibitors. There are two types in chronic: uricosuric agents and uric acid synthesis inhibitors. So uricosuric agents, this increases the excretion of uric acid in urine. So what happens? These uricosuric agents increases the excretion. So what is the mechanism? It inhibits reabsorption of uric acid in proximal convoluted tubules. Reabsorption is inhibited. So these uricosuric agents will decrease the levels of uric acid. So it is excreted, maximum is excreted through urine. Some of the examples are probenecid and sulfenpyrazone. It is N, sulfenpyrazone. Okay, probenecid and sulfenpyrazone. So in these patients who are taking this uricosuric agents, fluid intake should be increased. Okay, because to avoid stone formation due to uricosuric agents. These are not given in the patients who are having kidney problems. Okay, this drug interacts, these uricosuric agents will interact with weak acids like penicillin, cephalosporins, and fluoroquinolones. So this affects drug excretion. This increases their half-life and effectiveness. It is not given in acute condition. This is a chronic, right? Uricosuric agents are given in the chronic prophylaxis condition. So coming to the next, uric acid synthesis inhibitors. Now synthesis, we are going to see uric acid synthesis inhibitors. This inhibits xanthine oxidase. Okay, this inhibits xanthine oxidase by which leads to inhibition of the synthesis of uric acid. So this increases hypoxanthine excreted in this increased hypoxanthine will be there, that is excreted in urine. This may leads to kidney stones which are formed in the kidneys. Okay, one of the example for this is allopurinol, which is given in our syllabus. Okay, we have to see the synthesis for this allopurinol also. Okay, it is a suicidal inhibitor. Suicidal inhibitor in the sense it will inhibit its own metabolism by inhibiting xanthine oxidase. This allopurinol is a suicidal inhibitor. It inhibits its own metabolism by inhibiting xanthine oxidase. Leads to decreased urate crystals in kidneys, joints and soft tissues. Kidneys, joints and soft tissues where uric acid crystals will be decreased. So increased xanthine and hypoxanthine is excreted. Okay, it is used in symptomatic gout, chronic gout, hyperuricemia with cancer treatment, cancer therapy. So in cancer therapy, 6-mercaptopurine is also used, right? In combination with allopurinol, this leads to increased effect. Okay, this allopurinol will increase the effectiveness of this mercaptopurine by decreasing the side effects, and also dose requirement is also decreased. And first one is allopurinol and second one is febuxostate. Febuxostate. This is given when the patient is not tolerated with allopurinol. It is having only one side effect, that is hepatotoxic. And next one is rosburicase. This rosburicase is a recombinant technology produced urate oxidase. This is having a side effect like a hypersensitivity. Okay, now we are going to see, now we have seen just a quick revision I will give. Okay. So we have seen what is gout, What is hyperuricemia? Gout means increased levels of uric acid in plasma, and hyperuricemia is of two types, primary and secondary. Primary is not known cause, idiopathic, and secondary is which is associated with cancer therapy and drug therapies of different drugs. Okay. And again, coming to the management of drugs which are used in gout, acute one is there and chronic one is there. In acute, NSAIDs, colchicine and glucocorticoids are used. NSAIDs, indomethacin, naproxen and diclofenac is used. Colchicine is one of the drug which is used as anti-cancer drug, also antimitotic, and glucocorticoids which are fast. It shows the rapid action, that is prednisolone and methylprednisolone. And coming to the chronic, that is uricosuric agents and uric acid synthesis inhibitors. Coming to the uricosuric agents, here it is going to increase the excretion of the uric acid through urine. So reabsorption is stopped here. So probenecid and um, sulfinpyrazone. Sulfinpyrazone. This is there in our syllabus. Sulfinpyrazone we have to see. Okay, uricosuric agent and one uric acid synthesis inhibitor, allopurinol we have to see. Okay, synthesis we have to see this for this allopurinol. So allopurinol is one of the drug for uric acid synthesis inhibitor, and the second one is febuxostate and rosburicase. Now we are going to see allopurinol synthesis. Now starting we have to see the structure, right? So pyrazolo pyrimidine for all, pyrazole ring and pyrimidine ring, and at the fourth position OH, all group is there, right? So coming to the synthesis, this is the synthesis. Hydrazine, when it is reacted with ethoxymethylene melanonitrile, ethoxymethylene melanonitrile, it undergoes condensation by the loss of ethanol. 3-amino-4-cyanopyrazole, an intermediate is formed. This intermediate, upon hydrolysis in the presence of sulfuric acid at 40 less than 40 degrees centigrades, we have to heat it. We will get corresponding amide group. We'll get corresponding amide as a product. This intermediate product again when it is treated with formamide by the loss of water molecule and amine group, finally we are going to get allopurinol. This allopurinol is used to treat asymptomatic gout, chronic gout and hyperuricemia with cancer therapy. Okay, coming to the sulfinpyrazone. Sulfinpyrazone, this is the structure of sulfinpyrazone. See, here two benzene rings are there. One 5-membered ring is there with two keto groups, and it is having a sulfoxy group and benzene group. So see, at the fourth position of this ring, and 1 and 2 carbon atoms are there. At the second position, this group is attached. See, 4 to benzene sulfinyl, ethyl, this is the ethyl group. 1, 2 diphenyl, 1, 2 diphenyl pyrazolidine, 3, 5 dione. This is the IUPAC name of this sulfinpyrazone. Okay, what are the uses? Coming to the uses of this sulfinpyrazone is, it is used in the treatment of gout and gout arthritis. It leads to decreased uric acid levels in the body. Okay.